Welcome back to Kenton and Habiba. Welcome. Today I thought I would bring you some medical information that is important and pertinent as we stand today. So this video was recorded actually several months ago, but I thought that it just did not seem appropriate in terms of the timing. It was recorded right before the pandemic became, an issue or became a major concern here in the United States. And so I waited because I did not want to encourage people, obviously, to go see their doctor for non-emergent reasons. Now that things have settled into a new normal, so to speak, I thought that since you are now able, most of us, to either speak to a provider or see a provider, it would be important to share this information. So I'm hoping you get something out of it. Get your pen and paper ready. Obviously, the biggest thing on our mind lately is COVID, but we really should not also forget our general health. And there's so many things besides COVID that you really should be concerned or thinking about as it pertains to your body. So I hope you enjoy this video, and again, I hope that it is helpful. Please share this with someone who may find this valuable information. And okay, let's go. Welcome back to Kenton and Habiba. My name is Habiba for those of you that are new to the channel. And besides being a mom and wife, I also happen to be a medical doctor, an internal medicine physician, to be specific. And when I am not in practice or seeing patients, I like to make videos here on YouTube, such as this one. Okay, so the purpose of this video is to give you as much information about all the medical tests, or as many as I think are relevant based on your age and gender, okay? So there are a ton of preventative tests out there, and hopefully you are up to date. Things like mammograms, pap smears, prostate exams, colonoscopies, you name it, blood tests. We're going to cover it as quickly as I can here, and let's make sure that you have had the test that you need at the right time. Depending on the climate in which you are living or the current concern for this coronavirus, take what I say and use your common sense to decide whether or not you need to see your medical doctor. Number one, when was the last time he or she recorded your weight? Have you gained weight over the last year? Have you lost weight over the last year? I definitely advise you to have your provider keep track of your weight, like I said before, but also if you have a scale, which you should, try to keep track of your weight about once a week. So go on the scale first thing in the morning on an empty stomach, preferably without your clothes on, and weigh yourself. You don't want to do this every day because our weight, as you've noticed, fluctuates. It fluctuates depending on how much food you eat. It fluctuates depending on how much fluid you're getting in, whether you're dehydrated or not, and it fluctuates depending on how much you actually poop. So you want to make sure that you're not doing it too frequently because you don't want to get either discouraged or get the wrong, impression based on the scale. But in general, I would definitely suggest that you keep track of your weight with your provider's office too. And also follow their recommendations, as I've said before, because it may be different depending on what medical problems you have. If you are, say, someone with heart disease or renal disease, they may suggest you check your weight more frequently than that. Another reason to know your weight is because you also want to know your BMI, or your body mass index. So, you watching me right now, do you know your BMI? What is your BMI? All right, so your BMI is, again, your body mass index. It takes into account your height and your weight. So there are ideal numbers out there, or ideal measures to determine whether you are, normal weight, overweight, or morbidly obese. Usually a BMI of about 25 or under is considered normal weight. A BMI of above 30 is considered obesity. And of course, as you already know, certain medical conditions are more likely to occur or more likely to be precipitated depending on your weight. Now, if you don't know your BMI right now, you could probably just Google it. There are so many different apps out there online for free that will allow you to calculate your BMI. So all you have to do is Google BMI calculator, and it will ask you your weight and your height. You enter it, very simple, and you can calculate your BMI. So you should know this, and your doctor's office should also know this. The next thing you should know is your blood pressure. What is your blood pressure? I assume if you're watching me, you're probably over 18 years old, and if you are 18 and above, you should know your blood pressure. Okay, so if you're a healthy adult, if you're healthy, you don't have any medical problems, you don't have hypertension, and you are 18 and above, you should have your blood pressure checked at least every 3 years. 3 to 5 years, that's kind of stretching it for me personally. I would say at least every 3 years if you are over the age of 18. Now, what is ideal blood pressure? And it should be checked with an arm cuff, right? Not the ones that they use, around the wrist. I mean, those are okay if you don't have an alternative, but these ones that go around the arm, upper arm, are a lot more accurate. Okay, so ideal pressure should be around 120 over 70, maybe 120 over 80 max, but generally around that 120 over 70. So if you are 40 years old or above, like moi, you should have your blood pressure checked at least once a year. So even if you don't have any medical problems, but you are 40 or above, you should have blood pressure checks at least once a year. Your medical provider should know exactly what your blood pressure is, because as you get older, our weight tends to go up, and with that weight gain comes elevated blood pressure. So not everybody that is overweight or morbidly obese is going to have hypertension, but in general, as you gain weight, your blood pressure tends to go up, and definitely something that you need to keep an eye on or be concerned about. Okay, because as you know, elevated blood pressure or hypertension is linked to a higher risk of cardiovascular events, that is strokes, heart disease, so many other problems related to elevated blood pressure. Let's talk about your eyes, which reminds me, let me put on my glasses. A lot of times I don't wear them due to vanity, but I actually do have to wear prescription glasses. So, have you seen your eye doctor, by the way? Have you seen them this year? I know it's the beginning of the year. This is a good time for you to go see your eye doctor. Or did you see them last year? Well, according to the eye experts, you should have a comprehensive eye exam at least once a year. Now, that's going to change or be different for you depending on your age, depending on your medical history, and things like that. So for the average person, you should be seeing an eye doctor at least once a year. I can't tell you how many times I have had patients referred to me because the eye exam actually detected that they had diabetes or detected that they had hypertension. So a lot can be seen through an eye exam. This is how they find out whether you have glaucoma or cataracts or other medical conditions like macular degeneration, all things that threaten your vision. So make sure you have had your eyes checked by an optometrist, licensed optometrist, and or an ophthalmologist. Usually one will refer to the other depending on what they find. Now, I will add, and I'm going to look down at a note I had made for myself, that according to the Mayo Clinic, if you are in your 20s to your 30s, you should have an eye exam at least every 5 to 10 years. So again, like I said, depending on your age and your medical problems, it may differ. But definitely when you hit 55 or above, you should be having an eye exam every 1 year at a minimum. And then sometimes even more if you're older. But again, if you are conservative like me, or you have other medical problems, you're going to try to see your eye doctor at least once a year. The next thing we're going to talk about is seeing the dentist, because your oral health is very important, right? It's one of the first things people see is your smile. All right, number one, why do you need to see the dentist? Well, of course, you know that you want to make sure you don't have any cavities. You want to make sure that you don't have unhealthy gums, that you're not walking around with gingivitis that could be treated. And of course, if you are a smoker, you definitely want to make sure you don't have any oral cancer. You want to make sure not only they check your gums, but your teeth and your tongue, okay? And you know, honestly, your oral health is very important to your overall health. So definitely make sure you go to see the dentist. Ideally, you will see the dentist twice a year to have a cleaning, because you know, bad breath is not cute. So go see your dentist. Let's talk about mammograms. Who should have a mammogram? What age should you have a mammogram? I'm going to show you getting a mammogram myself, and then we're going to talk about the specifics.
All right. Let's go ahead and take your top off, and I'm going to slide an apron around you. I know you're not pregnant, I just like to shield you, okay? All right, hold that right around your waist there. I'm going to scoot behind you and hook you up. All right. And 2 views on each side, okay? All right. And we're going to start here in front. So facing the board here, you're going to come over here. Most important thing here is relax your shoulder. Perfect. All right. All right, you ready? Okay, that board's going to pull on you now a little bit from the top here. All right, you okay? Yeah. All right, we'll pinch you, okay? Hold really, really still for me. Hold your breath. Breathe, great, you okay? All right, so we'll scoot back. Now let's go ahead and do your side view. Same breast, we're just switching hands, okay? So most important thing here is relax his arm, okay? Try not to grip, because that tightens your muscle up under your arm there, okay? All right, and we're going to turn your body toward the machine.
All women should know what their normal breast feels like. You should know what your normal is. And if at any time you are concerned because you feel a lump, you have breast discharge, or you have pain, you should definitely alert your medical provider. Now, did you know men can get mammograms too? Yes, men are allowed to get mammograms if they have something that they feel is abnormal. Now, also, before you get a mammogram, or before you talk to your provider or have a mammogram ordered, you really need to know the risks, the benefits of getting a mammogram itself, because sometimes there are risks involved. And you should also have a realistic idea of what the mammogram is able to show. And this is something that you need to discuss with your provider. They also have these new 3D mammograms that can give you three-dimensional views of the breast tissue, and you can discuss if that is a good option for you. I do know that some of these mammograms, the newer ones, may entail or have higher levels of radiation associated with the test, so that is definitely something you want to discuss with your provider. All right, the next test we're going to discuss is your fecal occult blood test. This is your stool test, or the test that is used as a screening for colon cancer. All right, according to the American Cancer Association, this test should start no later than age 45. And this can be done on males and female, so no later than age 45. Now, if you have a family history of cancer, or colon cancer specifically, definitely make sure you have discussed this with your medical provider, because sometimes, or most times, your screenings might start a lot sooner. In fact, it may start 10 years sooner than when the first person in your family was first diagnosed with colon cancer. Which then leads me to a screening colonoscopy. Who should get a screening colonoscopy? All right, what is a colonoscopy? I'm sure you know what a colonoscopy is. Well, a colonoscopy is an imaging of your colon using a scope. It is usually done after the age of 45, okay? And it is used to detect colon cancer, or it is also used to detect colon polyps, some of which may be benign, some may be precancerous, and be required to be removed, and there also requires follow-up and surveillance. So that is what a colonoscopy is, and it is usually done while you are awake, although a large number of people also do it under sedation. So that is your choice, but it can be done while you are wide awake, and that is something you're going to need to discuss with your medical provider. So again, it is done after the age of 45, and if you are normal and healthy and nothing is found, it can be done every 10 years. Again, depending on what they find when they do that initial colonoscopy, the recommendations may change. Sometimes patients have to have another colonoscopy in a year. Sometimes they may have to have it in 3 years. Sometimes they may have it in 5 years. Again, it depends on what they find at the time of the colonoscopy. Now, how long should you continue having colonoscopies? Well, you can continue with recommendations to have colonoscopies up until the age of 75. So after the age of 75, it really is going to depend on your preference and what you've discussed with your provider. And certainly after age 85, you really do not need to have a screening colonoscopy. Okay, let's talk about prostate exams or prostate tests available. So if you have a husband in your life, or if you have a brother or a father, then you should be interested. Make sure that they have had a discussion, an informed discussion about whether or not to have a digital rectal exam, which requires a finger being inserted into the rectum to feel for the prostate, and whether they've had a PSA, which is a blood test to screen for prostate cancer, outweighing the risks versus the benefit. Now, there are many times where men can have an elevated PSA, very common, and it may not suggest prostate cancer. Sometimes it is just their norm. Sometimes it is because they have prostatitis, prostatitis being an infection, and sometimes it is prostate cancer. So they need to make sure that they've had a discussion and determined whether they are ideal candidates to have this test done. I know in most clinics that I have worked or places that I have worked, men over 40 are often tested or have blood tests done, the PSA. But again, there are many men that may have an elevated PSA that may not necessarily mean that they have prostate cancer. Now, if you're an African American male, you in particular need to be concerned, especially if you have a family history like your brother or your father had prostate cancer. You need to try to have that discussion with your provider after the age of 45 is recommended, or at least, you know, by the age of 45, you know what your PSA is. Okay, let's talk about pap smears. Have you had your pap smear yet? Maybe you're thinking, I'm not old enough, or maybe you're thinking, I'm too old for a pap smear. All right, let's talk about how old you should be. If you are 21 years or more, you should have had a pap smear. I've actually had pap smears done on women or young women that were younger than 21. If they were sexually active or if they were concerned about some, you know, STD or some other problem. But in general, the recommendation is that if you are 21 years or older, 21 years or older, you should have had a pap smear. And you should have a pap smear at least every 3 years, okay? So sometimes gynecologists will recommend that you have one every year, but at a minimum, if you are a normal, healthy woman, every 3 years, you should have a pap smear after the age of 21. Once you hit 30, once you hit 30 years old, you should have had a pap smear and had been tested for HPV. As you know, HPV is the virus that is associated with cervical cancer. So once you hit 30 years old, they should be doing both. Your gynecologist or your family doctor may test for HPV sooner, but the recommendation is that at least at the age of 30 or above, between 30 and 65, you should continue to have your pap smear and an HPV testing done. And you can have this done every 5 years or less, depending on your provider's recommendations. So along with that, usually when you get a pap smear, your provider will also do a pelvic exam if they think it's warranted. And a pelvic exam is looking to feel for masses, for any lesions that might be abnormal, any abnormal discharge, any pain. That's what they're doing when they do the pelvic exam. I would also suggest that if you're going in for a pap smear, that at some point you have had some STD, sexually transmitted tests done if you are sexually active. You want to make sure that you don't have HIV, that you know your status. You want to make sure that you've been tested for gonorrhea, chlamydia, syphilis, tests like that. And again, you have to, or your provider will adjust depending on your risk factors and your sexual history, which is why it's very important for you to be honest and open with your provider. All right, the next test we're going to talk about is an abdominal ultrasound. So an abdominal ultrasound is imaging of your abdominal region, and it is not a CAT scan, it is an ultrasound. Very different test, but it looks at the abdominal aorta. Okay, the abdominal aorta is the large main blood vessel that carries blood from your heart down to the rest of your body. Now, it is one of the screening tests that should be done, especially on people over the age of 65. So if you have a history of hypertension or high blood pressure, and you are a smoker, or one or the other, you want to make sure that you've had a discussion with your medical provider about a screening for abdominal aneurysm with an abdominal ultrasound. Okay, so the next test we're going to discuss is your bone density test, or your DEXA scan. Sometimes it's referred to as a DEXA scan or bone density test, and this will screen for osteoporosis or osteopenia, which is varying degrees of brittle bones or thinner bones, if I'm using non-medical terms. But basically, you want to make sure you have had that if you are 65 years or older. Make sure you've asked your doctor for it. Now, some patients are allowed to have a DEXA scan if they are chronically on steroids, because steroids, do have a risk of osteoporosis involved. So make sure you have that discussion with your provider depending on what medications you're on. But in general, people over the age of 65 are allowed to have a DEXA scan or bone density test. So let's talk about labs. And before we talk about labs, I just wanted to emphasize how important it is for you to follow up with your medical provider, because no matter how well you look up things on Google or you look up things online, you cannot get the personalized care that you need, that you will get by speaking directly to your medical provider. Because a lot of times certain tests that you need have to be adjusted based on your family history, based on your symptoms, and you can't always get that by just looking online. All right, so the first test I would like to discuss and make sure that you have had done is having your cholesterol checked. Your cholesterol is a good indicator of your heart health. So who should have a cholesterol checked? Anyone over the age of 35 should know what their cholesterol is. You should know what your good cholesterol is, your HDL. You should know what your LDL is, or your bad cholesterol. What about your sugar or your glucose? So if you get a basic metabolic panel, and not just a glucose test. But the glucose test in most cases is part of a basic metabolic panel, or a BMP, a series of tests that your physician or your medical provider ordered. On that BMP includes your sodium, your potassium, your BUN and creatinine, and these are tests related to your kidney function, in addition to your glucose. So I would suggest, if you are diabetic or if you have high blood pressure, you really should take an interest in knowing how your kidney function is. What is going on with my kidneys? You need to ask that question. Has it gotten any better? Has it gotten any worse? Because a lot of times, if you have uncontrolled high blood pressure or uncontrolled diabetes, or you are on medications that have certain side effects that are stressing out your kidneys, your numbers may go up. So you really want to make sure you know how you're doing, because your doctor may need to adjust your medication, or you yourself may need to improve what you're eating, your diet, or how you're managing your high blood pressure or your diabetes. So it's very important, because if you can avoid further kidney damage, you want to do that. Or God willing, you don't have kidney damage and your numbers are okay, but you're not going to know unless you ask. So make sure the next time you are at your doctor's appointment or provider's office that you ask about your kidney function, in addition to your glucose or sugar. So obviously, there are a ton of different blood tests available that your provider can order. They cannot order every test that is out there. It is not necessary, and it has to be driven based on, again, your symptoms and your family history and their suspicion for a certain condition. However, there is another test, your TSH, that I often do on females to make sure they don't have hypo or hyperthyroidism. So if you are a female and you're having certain symptoms, make sure you discuss it with your provider so they will know whether or not you should have a TSH ordered. I know now it is becoming a lot more routine for providers to go ahead and order this test. All right, let's talk about vaccines. So vaccines are not just for your children. You might be an adult and you might still be required to get certain vaccinations. Or at least some of these vaccinations might be suggested, and it's up to you. All right, number one, the flu shot, okay? So I know right now a lot of us are very concerned about the coronavirus, myself included, and the regular influenza vaccine or flu shot is not going to protect you against the coronavirus. However, it's going to make you less vulnerable, because if you're already protected against the flu, the last thing you want, or the best case scenario, is that you don't have to battle two infections, God forbid, if you are exposed to the coronavirus. So that would be one vaccine that is highly recommended, is your influenza or flu vaccine. And the flu vaccine is recommended for anyone over the ages of 18. Okay, another vaccine that you should have gotten is your Tdap. Tetanus, diphtheria, and pertussis. Pertussis is the whooping cough. So Tdap, we all have had, I would assume we have all had a tetanus vaccine when we were younger, but you will need to get a booster every 10 years. According to the CDC, a booster is recommended for TD, which is the tetanus, or the combined Tdap. So you should discuss that with your primary care physician or medical provider, whether or not you are due for a Tdap vaccine. The next vaccine that you might want to discuss or inquire whether you should have is the shingles vaccine. The shingles vaccine. Have you ever seen anyone with shingles? It is very uncomfortable. It is very painful. They get these blisters and rash, and it can be on either side of their body, and it can be on any part of their body. I have seen it on the back, I have seen it on the shoulders, I have seen it on the face, which is dangerous because it can even cause blindness if it affects the eyes. It's a very uncomfortable condition or infection, and it particularly infects people who are stressed. And when I say stressed, I don't just mean emotional stress, but also physical stress. So if they, for example, have had pneumonia or they're battling another infection, they often may get shingles because their immune system is battling this other condition and they have a weakened immune. So shingles is a real uncomfortable condition, and you really want to make sure that if the shingles vaccine is available to you, that you discuss it with your provider. How old can you be, or how old should you be to get the shingles vaccine? Well, it's usually recommended after the age of 50. But again, a number of people will get it by the time they are 65, at least here in the US. Another vaccine for my seniors is the pneumonia vaccine, pneumonia shot. So talk to your provider. If you are 65 years or older, there is the pneumonia vaccine that you may have already had or should have. Especially if you have risk factors being that you've had a history of pneumonia, or that you have a history of smoking, or you have a history of emphysema or COPD. So those would be risk factors, among others, that would make you a good candidate for the pneumonia vaccine. Thank you so much for watching. I hope you found this helpful. And I hope that you will take care of yourself and you will take care of your loved ones and make sure everybody gets the health screening test that they need. And look out for future videos. I hope to come back and discuss medical topics like DVT, which is deep venous thrombosis, which is a lot more common than you think. We'll talk about the risk factors and what you can do to make sure you don't get these sometimes deadly blood clots. Also, we'll talk about sleep apnea. We'll talk about my weight loss journey. We'll talk about healthy eating. So yeah, look out for more videos ahead. And also, in light of the coronavirus, really please take care of each other. And I hope everybody stays safe. One thing you can do besides the constant emphasis on washing your hands, which is extremely important, but one thing you can make sure you do is eat well. Eat well, take care of your body, sleep well, try not to stress too much, because as you know, all of that is additional stress on your body. If you are sleep deprived, if you are unhealthy and not eating well, if you're not getting the right rest. So again, take care of yourselves, and I hope to see you soon. Bye. So, just got out of the dentist, survived that. I don't know, it's absolute torture. I'm never gonna get used to that. But I have to say the dentist was really, really nice, really gentle, and had to give me like anesthesia or the pain medicine, injectable pain medicine, at least 3 times just to make sure I couldn't feel the pain. My heart was beating so fast because I get extremely anxious, extremely. But these are things we have to do. And what I was having was getting my old filling replaced. So I've had them for over 20 years. And apparently most of them should last about 10 or so, or more. But I've had these for over 20 years. Probably, yeah. So anyway, that's what got replaced. So I feel like my face is swollen and I can't feel this side.